Problem is that there are so many nerves which are going to the brain. You cannot block every nerve. The good news is that all these nerves at some point in time go in one pathway in the spinal cord. Science has developed a technique where you don't damage the spinal cord, but you actually put electrodes right sit where the nerves are going up and try to block the pain that way. This technology works on the posterior column of the spinal cord where all the painful nerves are going.
Patients that have had back surgery that are still in a lot of pain, patients that have pain in their legs that we just cannot manage with other modalities, we turn to neuromodulation. During the implantation of the spinal cord stimulation, we made 2 small incisions, one in the low back and one towards the middle of their back. In the middle of the back, we do put those small wires, small leads behind the spinal cord, and then we attach them to the battery, which goes into the side of the low back. We take every precaution, make sure we minimize any risk of infection and that the wound heals appropriately. And afterwards, patient moves on with their life.
The population which we deal with it, patient exhausted. All the medical interventions, they're exhausted, multiple surgeries. Nothing can be corrected. We cannot fix things. And we accept that the damage has occurred in the spine, in the disc, in the nerve. And neuromodulation is definitely something which has changed lives of these patients. You have patients who have multiple surgeries in the spine. You cannot do anything, they cannot bend, they cannot lift anything. They are not able to sit for too long in one position. They cannot sleep in their bed. They're all in a recliner. They are on huge medications. They have basically given up.
I think one of the biggest advantages of using spinal cord stimulation is that it's one of the few things in medicine you can try before you buy, because there is a trial period, usually lasts between 5 and 7 days, where we use a trial version of this device to see if it's the right thing for the patient.
You're able to reduce the pain 50, 60, 70, 80%. They're able to walk, they're able to sleep. Even though it's a normal functions for taken granted for that patient, it is absolutely huge. Just these 2 things are huge. And they're able to get on their life, they can talk, they can participate, they can have a sit-down dinner on Thanksgiving, they can talk to the family. I mean, these are the basic functions of us as a society, and which, if they get it back, I believe is huge, not in their lives, but their family's life.